this video webinar will be recorded, so if there are resources on here that you want to refer back to, please feel free to visit the njsophie.org website. So to advocate, what is advocacy? To advocate means to espouse a cause by argument, to plead in favor of, or to recommend publicly. In other words, education, and you can write this down, education plus action equals advocacy. The business of improving population health has always been linked to action. Advocacy is just an active process and asks that you be engaged in that issue. So I did this presentation back in April, and I thought that this issue would be finished, and yet we are still talking about repeal and replace of the Affordable Care Act and about federal funding for public health programs in this administration. However, one of the good things about November 8th, 2016 was that more people in public health have now gotten involved with advocacy in politics. One of the things that I'd like to mention with this cartoon are some of the lessons that we've learned with advocacy in public health. Generally, people will advocate on issues that they are passionate about. An American Journal of Public Health editorial from 2003 stated, "As important as data are to public debate, what people see, what they hear, and what they experience is often what drives passionate commitment to changing the public's health." So when we think about people who are affected by the ACA very intimately and the loss of it, or public health funding for their jobs, this is now the time when people are starting to speak up. But now we're going to learn about the details of how to get involved. Another thing that I'd like to mention is that people will be moved to action when they have something to lose or something to gain. So think about the things that we're passionate about while we're going through this advocacy webinar. In order to have your voice heard, you have to make a compelling argument. Health educators are really good at that. In order to make your voice stronger, you need to appeal to the people's sensibility that they have a voice and that it is important to speak up. And that's part of the reason why we're here today, just to encourage you to have a message, craft your message, and have your voice. It is important for you to advocate and for people to know that good health and healthcare are actually worth fighting for at legislation and to speak up about. Therefore, it is our job as public health professionals to get the general public and even our colleagues to continue advocating for public health. With any policy, bill, or regulation, advocating on an issue takes commitment as lawmakers debate, ponder, and as you can see, revise and decide. So let's start here. At the federal level, New Jersey has 2 U.S. state senators and 12 representatives in the U.S. House of Representatives. So this is at the federal level. However, while national bills and policy changes are always getting covered in the media, I would highly encourage you to start at the local level. This is your opportunity to get to know your local legislators. The main difference between federal and state legislators are areas of legislation. Federal legislation covers the most important laws pertaining to defense, international relations, treaties, currency, the financial system, homeland security of the country. So those 6 or 7 things. State legislation covers areas such as funding for elementary and secondary education, environmental issues, taxation policy of that state, and health and human services. So those things alone immediately impact our residents, and that will be a great place to make a juncture and get experience with advocacy. So as you can see here, I break it down with how many legislators we have in both the Senate and the General Assembly or the House. In case of a dispute, however, the federal legislation always has the upper hand over state, but a state regulation or legislation can be stronger than the federal. So I advocate for you, and this is very timely that we did this before November 7th, to go out there and rock the vote. The New Jersey legislature, if you've never been to this website, and I'm gonna try to attempt to go through it here. Can everyone see my, my mouse moving around? Just nod. Yes? Okay, Aurea, do you see it? Do you see the legislator website? No?
It looks like it's still loading on our side, Candy.
Oh, okay. So just let me know when it's up. Did it come up yet?
Maybe try to X out of your presentation and see if you could pull it up that way, Candace. I don't know if,
Sure.
or maybe try to click it again. I'm not sure why it's not showing up on our side.
Okay, hold on. Okay, sharing stopped. Okay, and let's share this. How about that?
Yes.
That works now?
Yes.
Yep, we can see it now.
Super. All right, great. So this is the New Jersey State Legislature website. The web link is here and it'll be on the presentation. Well, one of the things I wanted to point out is on this website, you can find how you as a citizen of New Jersey can sign up for updates on legislation, which is down here under subscribe. You'll have to identify the specific bill that you want to follow, and then you'll receive email updates on how it's being voted. And it's a great way to follow a specific point of legislation that you're interested in or want to follow. You can also find committees and their aides. So up here on the sidebar, if you guys can follow me, there's the Senate committees and the Assembly committees. And you can, what's more important though, are the committee aides. So just like the senators and the Assembly women and men, they are our neighbors and so are their aides. And their aides could also use some advice from a resident or a constituent who has knowledge on public health issues. So if we scroll down to the Senate committee aides and find the specific Senate Health Services and Senior Citizens Committee, you'll see their Democratic aides and the Republican aides. It doesn't hurt to give them a call and just make a connection. And that's one of the things that NJ Sophie is going to try to do and work with other public health organizations. The other public health organizations have also been very active in pushing for lead regulation and renewed legislation and funding for childhood lead poisoning prevention. So it's really important that we get on their viewpoint and on their radar to be able to advocate on the floor for public health issues. Likewise, if you go to the Assembly committees and you go to their aides, you'll be able to find the aides that sit on the Assembly. So there is the Assembly House and Senior Services Committee, and those are the Democratic and Republican aides as well, and there's other phone numbers. Again, it doesn't hurt to send them an email, give them a call, ask them how you can be of help to educate them, and we will talk more about that. So let me go back to sharing the PowerPoint. Hello, everyone. Okay. Let's see, where did my PowerPoint go? Oh, my PowerPoint has disappeared. Can you guys still see me? Yes? Okay. So I have to pull up the PowerPoint presentation again. Bear with me for 1 second. All right. One of the things I'll do, and I'm not going to toggle back into it, is that it's important to understand and know your legislator. So, for example, we have, in my district, we have Assemblywoman Mila Jacey and McKeon. One of the things I like about JC for Assembly is her website. Her issues are very clear. She has 5 main issues. And then if you look at your assembly person or your senator, what are their issues and are they important to you? If they are important to you, but you want to learn more about it, you might want to look on their website and where they stand and what regulations or legislation they're looking into passing. And you can find that on newjerseyledge.state.nj.us. So advocacy comes in all different forms. You can start at the individual or advocacy level. You can write or call your legislators. On the NJ Ledge website, you can find your legislators' email and their office numbers. They will have an office at in New Jersey at a local in the local town, and they'll also have one at in DC. So you can call either one and they'll get the message. Most likely try the New Jersey one also, especially if they're back home from recess. They would love to hear from you. Daily action phone calls with action items. Wall of Us has weekly emails with action items. Facebook pages and discussion groups are another place to get involved. And attending your local town hall meeting. That's also including your township board of ed, your township board of health, your township committee meetings that happen monthly, and they are required to notify the public when they occur. And they're usually listed on the newspaper. Organizational advocacy actions. We have, of course, New Jersey SOFI, but I'll start at the federal level. The American Public Health Association has a strong advocacy group, and one of the things that New Jersey SOFI does is we try to funnel those advocacy efforts from APHA to our members. The New Jersey Public Health Association, that's the chapter. And then there's, of course, our National Society for Public Health Education. Then there's us. The New Jersey Public Health Nursing Association is also another great colleague and advocate. So are the New Jersey Environmental Health Association on environmental issues. And they have a national affiliate as well. And then the affiliate for the New Jersey Association for City and County Health Officials is there too. I should add a third section, which is to be a patient or health advocate, where you advocate for a person's healthcare needs and services. Typically, these advocates are employed within a healthcare organization or an institution. You can also do this as a community health advocate within an organization, such as a social service organization. So membership in NJ SOFI or in any professional health organization has its benefits. You get to stay informed of the latest policy status and updates. Someone develops the talking points for you, so you don't have to do it by yourself. You just kind of have to push it out or sign. You are informed of key public health issues, and they're constantly changing. So that will be up to the Advocacy Committee in NJ SOFI, for example, to inform the membership. Resources and reference info, for example, like in this webinar, will be provided to you, and you have the opportunity to learn more in depth through continuing professional education opportunities like these. And you gain proficiency and competency in professional competencies and opportunity to be mentored on advocacy skills. Speaking of competencies, here are the competencies for area of responsibility 7 for health educators. It's to communicate and advocate for health and health education. So right from the get-go, as our profession, it is one of our 7 areas of responsibility. The areas that are listed in blue are for MCHES, so leading advocacy initiatives and evaluating advocacy efforts require a little bit more experience or a little bit additional training in order to meet that advocacy MCHES status. But we all can start at like 7-1 and go all the way through and use all of these competencies. And when you do those and you apply them into action, you can apply for CHES 2 credits by submitting to NCHEC. Okay, so this is coming up a little bit wonky, but gee, Candace, do tell me more about those advocacy skills. So if you've seen op-eds written in the newspaper, I don't know, does anyone read papers anymore? Like it's, you know, when you electronically look at the New York Times and they say op-eds, those are written maybe by, so you can say that you are from like the president of the American Public Health Association. That has credence. He seems like a worthwhile citizen, you know, and a worthwhile source. But he doesn't speak on behalf of the American Public Health Association. He is just stating that that's his profession and being transparent in that. You can write an op-ed and say, I am a health educator, and these are some of the things we'd like to educate the public on in terms of tobacco smoking or nutrition or food labels or syphilis in the community. And those are worthwhile things too. Again, using your professional status to lend credence to an op-ed is important. Policy briefs. Now, when you reach out to a legislator or to your town committee, maybe you want to try out writing a policy brief. So I've circled there, preparing a policy brief. That's a PDF, and you can read about how to write a policy brief. A policy brief is very short. It's probably a page, maybe a page and a half, maybe even less. They don't have a lot of time to read, so if you can be very succinct with your policy brief and your message, honing the message is really the most important thing. Writing a letter to your legislator, APHA is excellent about putting out draft letters. You can add to them, and they're electronic, and you just sign your name to it. Again, it's helpful to be a part of a public health organization. How to identify credible data sources, data analysis and interpretation. That's a huge part of being a health educator, is knowing how to find the data sources and analyzing and interpreting data. Communicating the science, that is what health educators are all about. Media and communications training, testimonials to a legislative committee, governing body, publication of journal articles, that's huge. If you are good at writing articles or want to submit to a journal, writing about advocacy in your experience, or a skill or technique that you've used would be key. Research data collection and survey development analysis. Again, another key skill of a health educator and how we can apply it to advocacy. Social marketing and materials development, and we'll get more on that later. Development of ordinances, resolutions, and regulations. This is all done at the local level, starting with ordinances at a local level, resolutions as well at a local level, and regulations at a local, county, and state level. You can look up your local ordinances on your town's website and see how they're written. They run the gamut, again, from like health, building, zoning, planning, garbage disposal, noise, things like that. Public comment notifications for upcoming health bills and statutes. If you have the ability or want to comment, there are always opportunities to make public comment on notifications for upcoming health bills and statutes. And obviously another great public health skill for health educators is coalition building. All of these skills that we've talked about can be applied to advocacy. When you talk about social marketing, people will advocate and listen to messages that they can relate to and that are visually appealing. Advocacy for public health does not only apply to legislators, although we've been talking about that for quite a bit, but it also applies to the community and to the people you are trying to reach and serve. Making sure that the images of the people are represented in the community, that it's written in a language and reading level that they can understand, and providing the pertinent information so they can be empowered to get to help themselves. These are all important aspects of advocacy and social marketing. So very simple messaging, attractive messaging, someone who might look like someone in that community that they could relate to, key phone numbers of what they can do to reach themselves. Not a lot of information, but just the succinct, pertinent information. So pretty much just the facts. So your job is to keep it all in perspective for the public as well as lawmakers. Most of our money, as many of you know, for public health is sent at the federal level to the topic of du jour, whatever topic people feel is important, mostly driven by public media and by loud public opinion. And whether that public opinion is based in science will be up to us. Or will it be based on emotions and fear or uncertainty? Will also be up to us if we don't speak out with science and data and master advocacy at the local, state, and federal level. So as you can see, you know, let's talk about obesity. No, let's talk about tobacco. Let's talk about SARS. Let's talk about alcohol. Let's talk about Ebola. So the money follows the news. So health educators and public health professionals really have to get out there and educate using the news platform to educate people. This is where the money should go. Not that it shouldn't go to Ebola, But don't forget that we have other issues that kill, like obesity or tobacco and alcohol, these chronic conditions that exist in our communities all year round. Advocacy, therefore, takes advocacy for public health issues, takes commitment, takes a long time, perseverance, and clarity of message and clarity of mission. Some of you might already have questions about the difference between advocacy and lobbying. So from the get-go, you have education, information, research, and analysis. From there, you don't have to do anything else. You can just continue to educate locally and do presentations and gather information and look up research and analysis. As I said before, education plus action equals advocacy. So when we talk about advocacy, you are taking your information and moving it outward to not only educate your local community, but changing minds in health behavior, as well as talking to legislators to maybe change how they perceive a legislation, whether it should pass or fail. Advocacy is the larger umbrella, okay? Lobbying is when you start to mention a bill or a law. So advocacy is when you're teaching someone. So you can send a policy brief about obesity, okay, about the importance of exercise in school health, about the importance of STD funding for youth, okay, or syphilis in young babies. You can send information out, and that's just education, okay? If you're talking to someone, whether it be an op-ed or whatnot, that's just advocacy. If you're just mentioning the topic and you're educating the public about facts. Once you start to talk about a legislation, and a specific legislation, trying to swing a vote, like vote for this because of X, and XYZ, and you can use those education components as your rationale to vote one way or the other. But once you mention that vote, and once you mention that specific regulation or legislation, that is now lobbying. If, for example, you work for a government entity, they have strict rules about lobbying. One of the benefits of being a part of a public health organization is that you can advocate for a bill without mentioning your place of employment. You can just say, as a member of NJ Sophie and as a constituent of New Jersey, I'm sending you a message to advocate for this XX bill. On that note, once you do an email from your place of work, once you copy anything from your place of work relating to your personal opinion about a bill, that is a definite no-no professionally. You cannot use work related supplies or equipment to lobby your personal opinion. Even if, let's say you work for the American Heart Association and they believe in advocacy, they want you to advocate, but unless it is a part of their advocacy branch and you're doing it for them, you can't use personal items, send messages via your personal email, even on a work computer, or copy anything or use their paper, none of that. So just know that you can do that personally. Once you get home, you can use your personal computer. Just don't mention where you work, just say that you are a constituent. Does that make sense to everyone? Okay. Here is, and I'm just gonna talk about some of these great sources right now. It has taken me a long time to figure out advocacy and how to be an advocate. I can't say that I'm the perfect advocate, but I'm struggling and learning with you. But what I'm learning, I'd like to share with you so you don't have to start from ground zero. But here are some really great advocacy efforts counts brochure from the Health Education Advocate. Resources on how to distinguish between advocacy and lobbying. The first one, Know the Difference Between Advocacy and Lobbying, is a one-pager, very simple, and talks about the distinct differences between even direct lobbying and grassroots lobbying. And then there's Advocacy versus Lobbying, Coalition Building, and Public Engagement. National SOFI has a great, they have a website, webpage specifically on advocacy. And if you want to learn about this, you know, remember how I told you, look at what an organization or your representative at the state or federal level, look at what matters to them. You might want to take a look at the report called Looking Forward, Health Education Priorities for America. These are National SOFI's areas of focus and what they're pounding legislation on at the state level, at the federal level. And you'll hear more about that from Tara because she actually went to the Public Health Advocacy Summit just this weekend. So hot off the presses, can't wait to hear about that. APHA, like I said, is such a strong advocate for how to make things happen in advocacy. So looking on their website for policy and advocacy and just taking what they've already done and sending it out to your local legislation is a very quick and easy way to be an advocate. The APHA has also published this legislative advocacy handbook. Cannot emphasize enough, this is ground zero. And these, if you are interested, might be a great place to do another webinar or another program at one of our annual meetings or mid-year meetings. And we can talk about walking through these resources and seeing, hey, how could I use this? And how could I dip my toe into this whole thing without getting too far afield? And we'd love to do that. Just give us your feedback at the end of the evaluation. In 2003, the health educators from New Jersey, a lot of these colleagues are from New Jersey. They published in the Health Promotion Practice, and it's from 2003. But even though it's 14 years old, it is just terrific information and just words of wisdom from colleagues who are really strong in advocacy back then and have words of wisdom to share with how a health educator can really incorporate advocacy and developing policy. Lastly, the 2016 New Jersey League of Municipalities, they created a legislative guide. Again, so great. It is very easy to read. I love how useful it is. And a lot of these tools have, or guides have tools in the back for appendices that are just templates that you can use and just copy and paste your format. This is an online reference for the Prevention and Public Health Fund work in New Jersey. So if you wanted to educate at the local, state, or federal level as to how we would use prevention and public health funding and what we would stand to lose if we lost public health prevention and public health funding in New Jersey. This might give you a two-pager look at why this funding is so critical and vital to us at what we do here in New Jersey. And then a vision for a healthier America. Back in 2016, the Trust for America's Health put out a vision brief pledge. So if you want to take a look at a greatly scripted policy brief and copy this, you definitely should do so. Online classes for advocacy. These have a little cost associated with them through Health Ed Partners, but I did just want to offer it up there. And the New Jersey Association of City and County Health Officials, or NJHCO, and the Public Health Association collaborative effort, which NJSOFI is a part of. We created an advocacy conference back in 2016, and these are the presentations on this website, and they're free. So feel free to click on those, learn from those. These are local and regional presenters that NJHCO organized. And it was a great presentation, so you should really take advantage of that. Again, it's free. One of the things as I end is, you know, like I said, I'm not the expert at advocacy, but I did want to start you guys off with some baseline of where we can begin the conversation and learn about doing more. But here's something I just want to show you. Okay, so this does not look fancy at all, but if you can see, can you guys see that? I just have just phone numbers of Senator Booker and Senator Menendez at their local offices and at their 202 Washington, D.C. numbers. I also have Representative Payne. He's also on there too. He's my guy in Newark. And so I just keep this by my office. And I call them when I can. to advocate for a specific issue. My phone calls have usually been, hello, my name is Candace Davenport and I'm a resident of Maplewood, and I'd just like to advocate to Representative Payne about funding public health, and it's vitally important. That is all you really need to say, because then they say, great, we've marked it off as an issue, thank you very much, and we'll get that message to Representative Payne. All they need is tally numbers of like what issues today were so important. So when people say flood their phone with just people advocating that this is an important issue to us, they hear you. They hear you because they tally those things every day. You don't have to give them the talking points. You don't have to it's Sally on the other end on the desk, and she's like, thank you very much, Mrs. Davenport, we've got it. It doesn't take long, 5 minutes at the very least, but just know that your voice is being heard. And if you don't call them, they don't get the message that that's important. And somebody else is doing that for you, advocating for their message, and that gets superseded. So just like to advocate that if you go to the NJ Ledge website today, you can pull up their phone numbers and make a quickie, post it, and it really makes you feel like you're connected to the larger picture, even just by making that one simple phone call. So I'm going to transfer it over to Tara, and I'll be navigating her PowerPoint, but that's all for me.
Okay, thanks. Can everybody hear me?
Yes.
Okay. I keep getting updates saying my internet connection is unstable, which is always fun. So we'll see how it goes. So hello, I'm Tara Rice, and I'm the current chair of the NJ Sophie Advocacy Committee. And as part of this role, I had the privilege of attending the 19th annual Sophie Advocacy Summit, which was this past weekend in Washington, D.C. So there were some great speakers there from the Prevention Institute and Trust for America's Health and the Sophie Advocacy Committee, National Sophie. So I'd love to just give you some highlights from the summit to share their perspectives about what's happening in terms of advocacy right now and some things that we can do. So it was a 3-day conference, and I'm going to try and summarize that in about 10 minutes. So it's going to be the highlights. So there you go. So a common sentiment that was shared is that these are challenging times, as I think we can all agree. But as a result of that, there's really a greater need for us to be advocates and a need for us to be practicing advocacy. And as Candace said, advocacy is really part of our professional competencies. This is something we're supposed to be doing as part of our jobs. And at the summit, it was described that health policy is often the missing piece in public health, or the next generation of health education, which made a lot of sense to me, because if you think about it, where do you make a bigger impact? Is it if you're asking someone to wear a seatbelt, or if you're creating a law where they have to? So although we're faced with many challenges right now, it's also a really exciting time for advocacy, because we've never had this many vehicles before to get our message out. You know, years ago, you'd think of advocacy, you'd think of people marching in the streets, which is important. But today we have ways of reaching large groups of people just within our phones, which is really, really exciting. Yes, thank you, Candace, you're right on point. So as you can imagine, a main topic that was discussed was the Prevention and Public Health Fund. So just in case you're not aware, the Prevention Fund was established by the Affordable Care Act. It supports almost $900 million in prevention grants from the CDC. And without the fund, current efforts to prevent infectious diseases like the flu and measles, chronic illnesses like diabetes and heart disease would really be crippled. And the Prevention Fund's been under constant attack. And the sense from the summit was that it's very likely that it will be defunded sometime this week, actually. And the money will be used for other efforts, which is most likely care and treatment, rather than what it was intended for, which was prevention. So of course, as health educators, this is alarming. So The prevention fund makes up, it's about 12% of the CDC's budget. So in addition to losing that 12%, if the fund goes away, there's a chance that the CDC will also lose an additional 18% of its budget. So that's about a third of the CDC's budget. And that will be felt mostly at the local and state level. So our call to action is really final efforts to help prevent losing this money. And these messages should be focused on what is at stake, as Candace had said. So oftentimes we talk about the prevention fund and just use the term prevention, but that term, it's very abstract and it doesn't always mean something to people. So we need to get very specific about what the fund pays for and how much money goes into each state to cover these issues. So New Jersey, I have the figure there, what we would lose over the next 5 years if the prevention fund is taken away. It's about 60 million over 5 years. And this graph here is from Trust for America's Health, which I have the link on the next page, but they've really gone state by state and pulled this data so that you can call your senators, your representatives, and talk about specifically what's at stake, for their constituents and for us in each state, which is really important to have a clear message. So this is the link I was talking about. Trust for America's Health has made it very easy. In addition to talking about the impact of loss of prevention it will have on New Jersey, there's some specific talking points that they've written out. So it couldn't be easier to sort of craft a message around what it means for New Jersey, and then also these messages of what it means in general. And the link is there at the bottom as well. So in addition to talking about, trying to save the prevention fund, it was another interesting point was, we're living in a 24-hour news cycle now. So we're constantly put on defense to defend this or react to the latest health threat, right? Every day there's something new. I'm sure you've all been feeling that as well. And, we can't spend all of our efforts and our time reacting to the latest cut or policy change. It's really important that in addition to that, we figure out how to advance policy and think proactively to advance campaigns. So, not just spending all our efforts reacting, but also thinking in advance what we can do. And a good way to do that was discussed was trying to focus on the bipartisan issues that have a lot of support, and what are the things we can focus on that we know will be supported on both sides of the aisle. So opioid was brought up as a good example. There's definitely, it's an issue that's in the news a lot. There's a lot of support around this. So we can think about what prevention measures would work best for the opioid crisis. Another example is the over 65 population. We know it's growing significantly. So what's the best prevention approach to create an environment where people can live independently and have less illness? And this is another bipartisan area that we can advance. One more thing. Oh, sorry. Can you go back one more? Sorry. One more thing that was interesting that was pointed out was when we're focusing on talking to our elected officials, it's helpful to have their priorities in mind. So oftentimes they're thinking about what change they can impact within their terms or how they can get reelected, right? So a good tactic is to show them research about policies that they can make a difference within 5 years. And that can have a positive impact on cost. So with this thinking in mind, the CDC developed something called HI5, which stands for Health Impact in 5 Years. And they did research on what policies or what community-wide approaches aimed at improving population health could have an impact within 5 years. And they listed them out. If you Google CDC HI5, HI5, it lists them all out. So that's a good starting point for issues that you may want to look at. And a lot of them are school-based programs to prevent violence, school-based programs to increase physical activity, early childhood interventions, enhancing public transportation, things like that. Okay, working at the local level. So Candace touched on this as well, but there was a lot of discussion about focusing our efforts locally. I think oftentimes when we think about advocacy or policy, there's this idea of legislation at the federal level or policies going through the houses, but there's really a need to work at both the federal and local level. And it was described as defend federal, work local. And useful policies often developed at the local level. One good example is child car restraints. It was actually started in Tennessee. So from there and from the impact and the results of that, it was adopted more broadly. But if all of us acted locally within our communities, that change can really percolate up. And just because there's a lack of political will at the federal level doesn't mean there's a lack of will or opportunity at the local level. So as Candace was saying, it's really good to know, who your state and local legislators are and get in touch with them and start thinking about what issues are important to them. Okay, so I wanted to just include some really actionable things that came out of the summit. Candace, again, touched on some of these, but this is what was just talked about this weekend, so I wanted to share what else we can do. So giving time to an organization involved in advocacy efforts. So there's many great organizations out there. We don't have to go at it alone. There was a bunch that were already recommended. So really, that's a good place to start, to just start working with another organization. And then educating ourselves on issues. I think this is something I face this myself. Sometimes even within my family, we'll be having conversations and I feel strongly about something, but I don't have the data to back it up. But not having data has never prevented me from having a strong opinion. But the best thing we can do is really educate ourselves and be armed with those statistics, that data, the research, and the personal stories to support our views so that we can really impact people and have those conversations. Another thing is we can vote with our wallets. So we can donate money to advocacy organizations, and we can choose to not buy products from companies that don't support our views or try to support those that do. That's a great place to be an advocate as well. There's talk about overloading the system. So there's been times over the past year where there was such opposition to certain events that the phone lines were completely clogged. And that really sends a message. So if the media can report that the phone lines were flooded because of XYZ, that sends a clear message that this is an important issue. So online methods are great, but really anything we can do that really shuts down, phone lines is wonderful. Developing an email template on specific issues with talking points, that's a great thing to do and can be shared with other people, and that can sort of create sort of a viral effect. Using social media to get your message out. Legislators really pay attention to these messages, so it's a great tool that we have at our disposal. And then meeting with policymakers. This FaceTime, it's so important. People can put a face to the name. So getting to know your school boards, your city council, your faculty, your Senate, all of that's really important. Another thing I think is a barrier is, people think it takes so much time for advocacy. Advocacy is time consuming. And there's often this thought of, I don't have time to do it. I know it's important, but I don't have time. And I think now, really, it's so important that it needs to be a priority for all of us. And you're all making the time to be on this webinar, so kudos. But it's important enough for us to do on our personal time as well. So a good way to do that is thinking about that and set some personal goals. Can you try and carve out a half hour a week to do something for advocacy? If you set goals for something, as we all know as health educators, you're more likely to achieve your desired outcome. So trying to make it a priority is important. And then, a lot of attention has been focused on trying to change people's opinions. You contact your representative or senator to say how you feel, to sort of change them, switch their views. But we can't forget that it's important not to focus all of our communication on our opponents, that our allies need to hear from us. It's important to say thank you. So when we're happy, we oftentimes are more complacent, but it's important to keep communicating even when things are going well, or when we know our senators or representatives agree with us. It's important to thank them for the efforts that they're making. This next point I love, stay on message. When you think you can't possibly repeat the same message one more time, you're just starting. Someone is hearing it for the first time. So we all know as health educators, it takes repetition is key for education. So keep repeating yourself, keep saying the same message, because you never know who you're encountering, who will be hearing it, and what that impact could be. And then lastly on this side, expose the problem. Numbers tell, stories sell. So really the point here is it's important to discuss and be armed with statistics, and both statistics and personal stories surrounding the issues we're advocating for. Some people are more logical and connect more with data, whereas others need to feel sort of the emotional appeal of a personal story. So both types of messages are really important.
Can you guys hear me? This is Candace. I just want to highlight for saying thank you. Just to note, that these senators or assembly people or advocates are putting themselves on the line for public scrutiny. And when they go out there on the media, while it seems like that is their job, they sure would appreciate a thank you. Just thank you for speaking up about this. Thank you for helping to raise this as an issue, because it is brutal out there getting scrutinized and being somewhat of a lone voice for public health. So I just want to say, if you want to take a positive stance and advocating for someone to keep going and speak the message, and that you're listening, is just as important.
Thanks, Candace. And so lastly, shameless plug here. If this presentation has inspired you, which we hope it has, we would love for you to join our advocacy committee. We're always looking for new members to help us with our efforts. And it's a great time right now because we're thinking about next year and what areas we want to focus on. So we'd love to have you involved. So if you're interested, my contact info is there, and I also emailed you about this webinar, so you can just email me and let me know. I'm a quote person. I love quotes, and these two came out of the summit, so I couldn't resist sharing them with you. Activism is my rent for living here, from Alice Walker, and our lives begin to end the day we become silent about things that matter, from Martin Luther King Jr. So that's it for me, and we are, well, sorry, Linda will will field the questions.
So thank you, Candace and Tara. It doesn't look like I just, Gwyneth, thank you for the resources that you've thrown up in the chat box throughout the course of the webinar. I do want to open it up if anybody has any questions. Just as a reminder, if you could unmute yourself prior to speaking, and then we can address those there. Any takers? I just wanted to make one comment. Again, I mentioned that this format is from NJHO, and there was a little bit of mention of kind of the childhood-led funding that has been added to the state budget. In my work with NJHO, it's been really interesting to see their increased advocacy efforts. And to Tara's point, one of the things that they have found is if you're going to meet with legislators, whether it's through NJ-SOPI or one of the other organizations that are met, if you have the opportunity to bring somebody that either lives or works in the district that the representative comes from, that is without a doubt the biggest takeaway that I've learned from our executive board. Essentially, they have said with every meeting, and they've gone on probably 60 to 70 over the last 12 months, the first question out of the legislator's mouth is, where do you live? Where do you work? Are you in my district? And essentially what they've said is when the answer is no, we don't, they are not tuned in. And unfortunately, that is the reality. So if there's any way to make sure that's part of your initial talking point, it may increase or perk their potential to listen to what you have to say. All right, So with that, Tara, I saw you unmute. Oh, all right, you're.
No, I was just going to
you
say
have
if
the
anyone
floor.
had any comments as well, it doesn't have to be questions, but comments are
Mhm.
fine.
Okay. Yeah, so well, thank you, Candice and Tara, for your presentation. It was great. And also while Tara was actually presenting, I had a question, but she actually answered it right away. It was when I was thinking, would it be like a good idea to like link previous decisions of the legislator or their priorities to the new issues we're bringing up, which she said yes, and she brought up the high five. So thank you for that. And also I have my question is that earlier when Candice was presenting, she mentioned, APHA, always having those letters that we can just sign at the bottom. And I know it's widely distributed. But how is it like looked upon at the other end who receives it when people just sign their name and not really change the letter? So they kind of like receive almost the same letter over and over. Would it be like fine with them? Like,
It's just a matter of, we got a letter about public health, prevention and public health funding. 1, we got another letter of public health prevention funding. 2, we got another letter. And even if it's a template letter, they just count it as the topic. So as long as they get a tally of the topic, whichever one rises to the top of that day, and let's say they're voting tomorrow, that's going to be the way they might sway or consider their vote. Or it might even give them a chance to say, hey, health aid, come here and do some research on this, because I've just gotten 50 letters via fax or email on this. What's going on?
okay.
So it doesn't matter. You can even tweak the letter. So they just give you a template letter of the key points, so you don't have to do the research, but you can add extra, like, I'm a health educator, but I work for, I don't know, some organization, and I don't have health insurance, so I rely on the ACA. So this personally affects me, and then just send it. So.
The other thing I will say on that note, I know from sending those template letters, I am guilty of not changing them, and you will get a template letter back from your representative. So just on my personal opinion, and to, I guess, reiterate what Candice is saying, if they're sending you back a automatic reply, I think it's more important just to make sure that they're getting that message or that you're interested in that particular topic.
But the template letter that you will receive is about that specific issue. So they are reading it in terms of like, okay, this headline was on gun violence. So then they'll send you a template letter on their stance on gun violence and their informative facts about this issue and whether they stand for or against it. So you will hear from them. And I think that that's a really cool thing to have and add to your, folder of like, oh, here are my advocacy things, and this is my conversation with my local representative. They work for you. One thing I'd also like to mention is that Tara said that the prevention and public health funding is going to go again on the floor this week. Has anyone heard it on the news that it's going on the floor this week? No. And that's the problem, is that we are not getting it out to the media that this is a huge issue and that we will lose, again, $60 million in terms of local funding and state funding for our programs. These are not only our jobs, but the people who we serve will be at greatest risk. That's almost a third of the CDC budget right there. And so we need to advocate. So Tara, my question to you is, are you saying make a call to like Booker Menendez and our state assembly people, or to our locals as well? What was their suggestion at the summit?
Yeah, I mean, I think Booker and Menendez, this goes back to my point of saying thank you, because sometimes I know what their position is, and it's oftentimes the same as mine. So sometimes I don't approach them, but I should, because then they can say, we received contact from 10,000 people, and I could be one of those people that they can say are supporting them. So yeah, contacting them. And I was just reminded of another resource. If calling isn't your thing, you can also use ResistBot. Have you guys heard of ResistBot? It's great. You can text the word resist to 50409. So I'll say it again. You text the word resist to number 50409, and it's a service that will help you draft a letter to your congressperson. It takes like 2 minutes. It's my sort of introverted way sometimes of contacting people. But yeah, I mean, I think the reason it's not in the news, my guess would be because the funds will be used for healthcare. So in most people's minds, oh, that's okay because it's going to be used for healthcare, which is needed. But we know that prevention dollars, every dollar spent on prevention, I think the stat is saves $10 down the road. So, we are the ones that know that this message, that this money is important. And one more thing to add to that, sorry, that I'm remembering, is even if the fund goes away, the important thing is that that money just goes back into the CDC. So, even if the prevention fund is defunded, just make sure the CDC has those dollars somehow to continue those programs. So it's not so much, I know I talked a lot about defunding the fund, but it's not so much about that. It's just making sure the CDC doesn't lose that $60 million over 5 years.
All right, great. Well, thank you for the questions, and I don't mean to cut them off, but I do want to keep us on time, so I'm going to end our Q&A at this point. I do have just a few other general reminders as we're getting ready to log off. Tara will be sending out the evaluation for the webinar shortly. Please make sure you complete that because we are trying to increase the number of options that we have available to health educators around the state, and particularly NG-SOFI members. And within that, just please make sure if you are claiming CHES or MCHES credits, make sure that you put your number there. We cannot send those on to NCHEC to get them on your transcript unless we have your number. If you have any other questions that you come up with after the webinar, please feel free to reach out to Tara or Candace directly, or certainly put those in the evaluation that you complete. And then also in that evaluation, if you have other topics that you would be interested in seeing in webinar format in the future, please let us know because we are trying to actively plan for 2018. And Tara joked about the shameless plug for the Advocacy Committee. I'm going to take one more opportunity for a shameless plug. Our NG-SOFI annual meeting is scheduled for December 7th at Monmouth University. We're actually going to be talking a little bit more specifically about credentialing resources throughout your career. So regardless of where you are, if you're a student, new professional, or more experienced in the field, consider joining us on December 7th. The registration form should be available on ngsofi.org probably within the next 3 to 4 days. So we will send information on to all of you once that is live. So with that, I thank you very much for your time. And Candace, are we going to be sending out these slides? You referenced that. Will we send them with the evaluation?
Sure. I can send these. I can send these to Tara, and she has everyone who's listed on here, so we can send it.
Great.
On this webinar, we'll have firsthand, immediate access to these slides, if that's okay.
Excellent. Okay.
All right.
Thank you, everybody, for your participation. We hope to see you at a future program or a future webinar for NG-SOFI.
Take care.
Thank you.